Hello everyone. So let's start with the target NEET PG 2022 anatomy session second. So this is targeting for your entrance exam NEET PG 2022. Myself Dr. Monalisa, and I have done my MD anatomy from Armed Force Medical College Pune, and I am here to discuss all the important and the relevance. Okay, so this is a series which has been started where I am going to discuss the important all the important MCQs related to your competitive exam, that is targeting NEET PG 2022. So before starting the session, I would also like to tell you about the special session benefits. It's an interactive live session where the educator and the learner can interact among themselves. Polls are conducted. Raise your hand and get your doubts clear right itself in the session. Never ever miss a session. Lecture notes. So after completion of the session, you can download the PDF notes that will be extremely beneficial for you. Anywhere, anytime, read from top educators of Unacademy platform at your own place. So what are the benefits of the plus course if we compare it over the special course? So when I am talking about the plus course, you can access both live in the recorded version. You can study on the device of your choice. You can study from the top educators of Unacademy platform. You can access more than 25,000 MCQs. You can compete in live tests and quizzes. And with 1 year of subscription and more, you can get the PDF notes provided. You will get the printed notes of the plus subscription. So all these benefits can be targeted by you in the plus subscription of Unacademy. Now let me talk about the iconic subscription. So when I am talking about the iconic subscription here, not only the benefits of the prep ladder, but also the Unacademy plus course and the prep ladder is merged together. So all these benefits can be assessed by you. These benefits are, what are these benefits? These benefits are clinical and integrated essentials video lectures from the dream team, QBank 3 with active guidance tags, rapid revision, snapshot, treasure, dream notes of 2021. So all these benefits, that means the benefits of the plus course of the Unacademy and the prep ladder is added on. So this is highly beneficial for you. Boost your medical preparation. So what is this amazing benefit which I want to tell? Take 24 months, that means 2 years of subscription and get 4 months of subscription absolutely free. Take 12 months of subscription and get 2 months of subscription absolutely free. Take 6 months of subscription and get 1 month of subscription absolutely free. So these are the benefits can be targeted by you. So just go for it. It will be highly beneficial for you. So you can use the code NAT10 and take the subscription. That will provide you 10% discount. So you can get 10% discount by taking this subscription. My dear aspirants, I would also like to inform you about the 28th November 5 PM session. You can enroll for this NEET PG Compact, which will be highly beneficial for you. NEET PG Compact timing is 5 PM. More than a scholarship of 1 crore rupees is provided. So all 200 participant rankers will get the scholarship. So just go and grab this opportunity. Enroll by using an NAT10 code and be present on 28th 5 PM. All the best, my dear aspirants. Now let's start with the NEET PG targeting 2022 MCQ session part second. So let's start with the first MCQ of today's session. Carpal tunnel contains all of the following except. So what you can see here, 4 options are there. Carpal tunnel, median nerve, 4 tendons of flexor digitorum superficialis, 4 tendons of flexor digitorum profundus, and flexor carpi radialis. So you have to tell me which of the following options A, B, C and D, which muscle, tendon or the nerve is not a content of carpal tunnel. So yes, you can take 15 to 30 seconds and you can mark the correct answer. Okay, so my dear aspirant, the correct answer is flexor carpi radialis. Actually, FCR tendon, that is flexor carpi radialis tendon, is not a content of carpal tunnel. Okay, what is carpal tunnel? Carpal tunnel is a space which is lying below the flexor retinaculum. Okay, carpal tunnel is a space which is located below flexor retinaculum, and through this passes the flexor tendon, digitorum, profundus tendons, median nerve. And actually when I am talking about flexor carpi radialis, it is not passing below the flexor retinaculum. Exactly, it is passing in a gap between the flexor retinaculum. So yes, so my dear aspirants, just see this diagram. Here in this diagram, you can see here I am highlighting with dark green color the flexor retinaculum. Actually, the other name of flexor retinaculum is, it is also called as transverse carpal ligament. So see here, I am highlighting it. This transverse carpal ligament is the other name of flexor retinaculum. okay, flexor retinaculum. And what you can see, the space which is residing below this green color transverse carpal ligament is the carpal tunnel, and the structure which is passing through it. So let me show you. Flexor pollicis longus, flexor digitorum profundus, and that of flexor digitorum superficialis, tendon, and one nerve which you can see here, that median nerve. So these are the structures which is transversing. Now what you can appreciate for the flexor carpi radialis tendon, if you will see the flexor carpi radialis tendon, it is exactly passing between the slip. Can you see here, the transverse carpal ligament is dividing as like a fork or a Y shape, and in that gap the tendon which is passing is flexor carpi radialis. So please note down the structure. So I would like to give you the details of structures passing superficial and deep to flexor retinaculum. So write down. Firstly, structures passing through carpal tunnel. That means below flexor retinaculum. The structures are median nerve, tendons of flexor digitorum superficialis muscle, that is the 4 tendons of flexor digitorum superficialis, and tendons of flexor digitorum profundus. That means 4 tendons of flexor digitorum superficialis and 4 tendons of flexor digitorum profundus. And this is the fourth content is flexor pollicis longus. Now my dear aspirants, I would also like to give you the details of structures passing superficial to transverse carpal ligament. So please write down. Structures passing superficial to FR in short form, that is flexor retinaculum. Structures passing superficial to flexor retinaculum. The structures are ulnar nerve, ulnar artery, palmaris longus tendon, palmaris longus muscle tendon, which is a degenerative muscle, palmar cutaneous branch of ulnar nerve, palmar cutaneous branch of ulnar nerve, palmar cutaneous branch of median nerve, and also the ulnar nerve. So note down, ulnar nerve along with, okay, ulnar nerve we have already written. So transverse nerve along with ulnar artery. So actually this ulnar nerve and ulnar artery is covered by a superficial slip of transverse carpal ligament, which is called as the volar carpal ligament. Volar carpal ligament. So it is passing below volar carpal ligament, and the other structures are palmaris longus tendon, palmar cutaneous branch of ulnar nerve, median nerve, sometimes superficial branch of radial artery also. So done with this, let's move on to the next MCQ, that is MCQ number 2. All of the following are true about the root of right lung except. All of the following is a true statement about root of the right lung except. So here you can see azygous vein crosses its above. So if we see the root of right lung, azygous vein is related superiorly, that means right atrium is located anteriorly. The vagus nerve is related anteriorly and superior vena cava is present anteriorly. So my dear aspirants, take 15 to 30 seconds and mark the correct answer. We have got 4 options and you have to mark the correct answer. Your time begins now. Question number 2. So my dear aspirant, the incorrect statement and the correct answer for this question number 2 is vagus nerve lies anterior. This is absolutely wrong. Actually, vagus nerve is related posterior. It is related posterior to the right lung. It is related posterior to the right lung root, not anterior. So this statement was absolutely incorrect, and so this becomes the correct answer for question number 2. Now my dear aspirants, I would also like to show you this image where you can highlight and we can understand the relations. So what you can appreciate, that this is the azygous vein, And yes, clearly you can see the azygous vein is arching superior or above the root of. So this structure which you are seeing is the hilum and the root area of the right lung. So azygous vein is lying superiorly. Superior vena cava, as you can see, is also lying anterior to it. Superior vena cava is also related anterior to it. So here you can see right atrium and right auricle. This is also related anterior. So these three structures which was mentioned in the MCQ, all these three structures, so azygous vein superiorly, superior vena cava, right atrium and right auricle is related anteriorly. So this is the area of right atrium and the lung, and this is the superior vena cava. But when you will see the nerve, so the nerve is the vagus nerve. Yeah. So when you will see the vagus nerve, you can clearly see this is the vagus nerve and this vagus nerve. So if I use another color, so black color only, this is the vagus nerve and it is traversing posterior to the right. It is traversing posterior to the right lung root. So this is the incorrect option. So let's move on to the third one. Right hepatic vein drains which segment of the liver? Right hepatic vein drains which segment of the liver, whether it is segment 1, whether it is segment 1, whether it is segment 2, 4 or 7. So your time starts now. You will get 15 to 30 seconds and you have to mark the correct answer. Right hepatic vein drains which segment of the liver? So this is the segmental anatomy of the liver you have to know for marking it the correct answer. So that is important that you should know the segmental artery very well for marking it the correct answer. So here we have got following options. A, B, C, D is there. Question number 3. So actually the correct answer here is question number 3. The correct answer here is D. So D is the correct answer. Okay, right hepatic vein drains which segment of the liver? So D is the correct answer. So my dear aspirants, if we talk about the segmental anatomy of the liver, it is based on the distribution of the portal vein and the hepatic vein. So it is based on the portal vein distribution and hepatic vein. Actually, French anatomist and the surgeon Coinot divided each physiological and the functional lobe of the liver into 4 segments and it was further subdivided. So altogether we have got 8 segments in the liver. Okay. So what is important for us to know that what is the drainage of these segments? So what I want to tell, actually the physiological left lobe. So it is important that you should know actually the physiological division of the lung is taking account of the equal distribution of the portal vein, hepatic artery and the duct, bile duct. So that will designate as the segment. So let me write. The great anatomist Coinot divided each of physiological lobe. What is physiological lobe, my dear aspirants? It's the functional lobe. Each of the physiological lobe or the functional lobe of liver into 4 segments. That means 4 segments in the right hand side and 4 segments in the left hand side. Hence, the whole liver is divided into 8 segments. Hence, the whole liver is divided into 8 segments. Hence, the whole liver is divided into 8 segments. Altogether, how many segments? 8 segments is there. Now, physiological left lobe of the liver. Physiological left lobe of the liver consists of 4 segments designated as 1 to 4 and this is supplied by what is the drainage? So it is supplied by left branch of hepatic artery, drained by left tributary of the portal vein, and also drained by left hepatic duct and left hepatic vein. So here it is clear that when we are talking about the physiological left lobe, it is drained by the following structures, and segment 1 to 4 belongs to left physiological lobe. What about the right physiological lobe? So when I am talking about the right physiological lobe, the right physiological lobe is consist of segment 5th, 6th, 7th and 8th, and it is supplied by right hepatic artery. It is supplied by right hepatic artery, right branch of portal vein, and drained by right hepatic duct and right hepatic vein. So my dear aspirant, it was asked in the only after discussion we are clear that it's the lobe 7 is the correct answer. As you can see, it belongs to the right physiological lobe. Now I want to add on one more point when we are talking about the segment 1. So segment 1 is very peculiar. So when I am talking about the segment 1, okay, this segment 1 corresponds to caudate lobe, which is important for you to know, and segment 4 is corresponding to quadrate lobe. But what is the peculiarity of caudate lobe? Caudate lobe is drained and supplied by both right and the left hepatic branch. So it is exception because caudate lobe is supplied by both right and the left hepatic artery. So this is exception for this. So caudate lobe, star mark, drained by both right and the left hepatic arteries. So this is an important information which has to be known to you. Now see here. And this is a diagram where you can clearly see the segmental anatomy of the liver. You can see on the equal distribution of the branches of the hepatic vein, so the branches of portal vein, hepatic artery and bile duct. So it's the three structures which is taken into account, that is hepatic artery, portal vein and bile duct. And to choose one, we will go with the portal vein. The most important criteria for the equal distribution of these segments and these physiological lobe is by the portal vein. As you can see in the diagram, the segments are 1st, 2nd, 3rd, 4th, 5th and 6th. As you can see here, 5th, 6th and 7th. And when I am talking about 5th, 6th, 7th and 8th, this is belonging to the right side, right physiological lobe. 1st, 2nd, 3rd and 4th is belonging to the left physiological lobe, and here one is very peculiar to be drained by both right and the left hepatic artery. So yes, once again moving to this question, right hepatic vein drains into which segment? The correct answer is D, that is 7th segment, 7th liver segment. Okay, my dear aspirants, let's move on to question number 4th. Which of the following is a derivative of Richard's cartilage? Richard's cartilage. What are the option provided? The option provided is stapes, malleus, incus and sphenomandibular ligament. Okay, stapes, malleus, incus and sphenomandibular ligament. These are the options provided and you have to tell me the correct answer. Derivative of Richard's cartilage. Your time starts now. You will get 15 seconds for marking the correct answer. Now, my dear aspirant, the derivative of the Richard's cartilage is stapes. This is Richard's cartilage. When I am talking about Richard's cartilage, this Richard's cartilage is the cartilage of second pharyngeal arch. Richard's cartilage is the cartilage of second pharyngeal arch. Richard's cartilage is the cartilage of second pharyngeal arch, and stapes is absolutely correct answer. Why not malleus, incus and sphenomandibular joint? Actually, these all belongs to the first pharyngeal arch. So I would like to give you the list of structures derived from the second pharyngeal arch or Richard's cartilage. The cartilage of second pharyngeal arch is Richard's cartilage and the derivatives of Richard's cartilage is, write down, derivatives of Richard's cartilage. The derivatives of Richard's cartilage is Stapes bone, the stelloid process, small corona of the hyoid bone, stylohyoid ligament, and superior part of body of hyoid bone, superior part of body of hyoid bone. So yes, these are all the derivatives of Richard cartilage. So it should be tip of your tongue. This is very important for your MCQ session. Okay, my dear aspirants, let's move on to the next, that is question number 5th. Median nerve supplies which branch to brachial artery? Median nerve supplies which branch to brachial artery? Whether it is sensory, whether it is motor branch, whether it is sympathetic branch, or whether it is none of the above. Question number 5th, mark the correct answer. Median nerve supplies which branch to brachial artery? It is giving sensory branch, it is giving sympathetic branch, it is giving motor branch, or none of the above. Question number 5th, your time starts now. You will get 15 seconds to 30 seconds to mark the correct answer. The correct answer is B, that is sympathetic branch. Actually, median nerve supplies and gives vascular branch to brachial artery. What it is supplying? It is giving vascular branch to brachial artery, and these fibers are containing sympathetic fibers. Actually, when I talk about the median nerve, it is providing no sensory branches or any kind of cutaneous branches or any kind of motor branches in the arm. It is giving out a cutaneous branch when it extends into forearm, forming lateral cutaneous nerve of forearm. And actually, if I talk specifically the branch which is given by the median nerve to brachial artery, it is the vascular branch containing sympathetic fibers. So this is the detail which is very important for you. Please write down. Median nerve supplies vascular branch to brachial artery. It gives vascular branch to brachial artery. It is providing vascular branch to brachial artery in the arm. Median nerve has no sensory, doesn't give any sensory, has no sensory or cutaneous branch in arm. Okay, the only branch given off in the region of arm are sympathetic branch to brachial artery, which was the correct answer. So that was the correct answer. So not only this, median nerve is also giving no motor innervation. So median nerve is not giving any motor branch also in the no motor branch. Median nerve is not providing any motor branch in the arm. It is supplying the muscles of forearm flexor group. Okay, basically. So this is the correct answer. Let's move on to the next, that is question number 6. Which of the following is a true statement about longus coli? Which of the following is, question number 6 is a true statement about longus coli. Origin of longus coli muscle occurs in the occiput extensor of the neck. It's an extensor of the neck. Nerve supply is from C2 to C6 and inserts on C3 to C6 cervical vertebra. So here you can see 4 options are there and you have to mark the correct answer. Question number 6, your time starts now. You will get 15 to 30 seconds to mark the correct answer. Which of the following is a true statement about longus coli? Okay, my dear aspirant, the correct answer is C. Nerve supply source is from C2 to C6. Actually, longus coli muscle is an example of prevertebral group of muscle in the neck, and its innervation is by anterior rami of C2, C3, C4, C5, C6 from the cervical plexus. And if I categorize the longus coli muscle altogether, when the longus coli muscle of the both the side is acting and contracting, it is causing the weak flexor of the cervical spine, and when it contracts unilaterally, it tilts or rotates the cervical spine to the ipsilateral slide. And if this longus coli muscle again is consist of three component or three parts, that is superior oblique part, the lower inferior oblique part, and the central vertical group of the muscle. So then I will show you the diagram for it, and I will also tell you about the origin and insertion. Please write down the details of longus coli muscle. So the heading here is longus coli muscle. Okay, longus coli muscle. Yeah. So when we are talking about longus coli muscle, it's a muscle of prevertebral group. It's a muscle of prevertebral group in the neck region. It's a muscle of prevertebral group in the neck region. And it is innervated by anterior rami of C2 to C6 branches from cervical plexus. Now, let's talk about its action. Longus coli muscle is weak flexor. It's a weak flexor of cervical spine. It's a weak flexor of cervical spine when it is contracting bilaterally. So this is happening when it contracts bilaterally. When I am talking about its ipsilateral contraction, so when longus coli muscle contracts unilaterally, what does it do? When it is contracting unilaterally, it tilts and rotates, the cervical spine ipsilaterally. Now coming to the component of longus coli muscle. So when I am talking about the longus coli muscle component, so it is having, what I told you, it is having three components. It is having its superior oblique part, it is having lower inferior oblique part, and the third component is it is having intermediate fibers, that is central vertical part. So these are the three components of longus coli muscle. Let me show you a diagram for it. So see here. Here's the diagram where you can see this is the longus coli muscle. This is the superior oblique part. This is the vertical. The vertical is the middle part. So these are the fibers of the vertical. So this is the middle, and the lower part is called as inferior oblique part. So let's talk about this longus coli muscle origin and insertion. So if I talk about the origin part, the upper, that is superior oblique part, is getting origin from the anterior tubercle of transverse process of C3, C4, C5 cervical vertebra. The central or the intermediate vertical part of the fibers of longus coli muscle, this is originating from anterior aspect of the vertebral body, and what is the origin point? C5, C6, C7, T1, T2, T3 vertebra. The lower oblique fibers arises from anterior aspect of the vertebral body of T1, T2 and T3 vertebrae. So this is all about the origin. This is all about the origin of longus coli muscle. The upper, central and the lower part, which we have just seen in the diagram also. Upper part is the cervical part, The vertical part, intermediate and lower part is traversing toward the thoracic region, originating from T1, T2 and T3. Exactly. Now, insertion. Upper fibers inserts into the anterior tubercle of first cervical vertebra, that is atlas. Central or the vertical intermediate fibers inserts onto C2, C3, 4 cervical vertebrae. Vertebral body is anterior aspect of the vertebral body of C2, C3 and C4, and lower fibers on the anterior tubercle and transverse process of 5th and 6th cervical vertebra. So, my dear aspirants, in short, we have completed one of the important muscle, that is longus colli muscle, having 3 components innervated by the ventral or anterior rami of C2, C3, C4, C5, C6 cervical branches of cervical plexus, origin, insertion, and we have seen the diagram showing the 3 components of the longus colli muscle. So, clearly here we can say the correct statement about longus colli muscle is innervation by C2 and C2, C3, C4, C5, 6 ventral rami. Okay, we have also discussed the action, and we have seen that when the longus colli muscle is contracting bilaterally, it is causing flexion of cervical spine, and when it is contracting ipsilaterally, it causes or tilting and the rotating of cervical spine to the ipsilateral side. So, that also we have discussed. Let's move on to the next MCQ, that is MCQ number 7th. All the best to everyone for the 7th number MCQ. Now, which artery is supplying the stomach and also traversing in the pancreatico-duodenal region? Among the option provided, we have got 4 options: right gastroepiploic, left gastroepiploic, right gastric artery and short gastric artery. So, what is important here? We have to pick the most correct statement. For question number 7, you have to pick the most correct statement here. Which artery supplying stomach region in the pancreatico-duodenal region? Pancreatico-duodenal region. 4 options are there, and you have to choose the most correct answer. Whether it is short gastric artery, whether it is right gastric artery, whether it is right and the left gastroepiploic artery. So, your time starts now. Mark the correct answer. So, the correct statement here will be right gastroepiploic artery. My dear aspirant, the correct statement will be right gastroepiploic artery. Question number 7. Right gastroepiploic artery is the correct statement. So, yes, when I am talking, actually this right gastroepiploic artery, which is a branch of gastroduodenal artery, this is traversing and giving, actually on the greater curvature, we have got anastomosis of the right gastroepiploic and left gastroepiploic artery. Left gastroepiploic artery is a branch from splenic artery. Okay. So, yes, and these short gastric artery also a branch from the splenic arteries. Right gastric artery either branch from common hepatic artery or the proper hepatic artery, both are correct. So, these are the branches, but when you will see the coursing of right gastroepiploic artery, branch of gastroduodenal artery will traverses towards the pancreatico-duodenal region. So, see here. Here you can see the celiac trunk is the source of its direct branches will be 3, that is the splenic artery, one of the largest branch of celiac trunk given at the level of T12. Left gastric artery is also the direct branch, and we have got the hepatic artery. Okay. And we have got the hepatic artery branch. So, here we have got hepatic artery, which is giving again the right gastric artery, which is giving again the gastroduodenal artery, which is again giving right gastroepiploic artery traversing. So, it is anastomoting with the left gastroepiploic artery along the greater curvature, and then it will traverse transversely through the pancreatico-duodenal region. As you can see, pancreatico-duodenal region is the region where it traverses. Okay. So, got it? Let us move on to the next, that is question number 8. Nerve supply of circumvaled papilla. What is the nerve supply of circumvaled papilla? Whether it is glossopharyngeal nerve, whether it is coda tympanic nerve, whether it is vagus nerve or lingual nerve. So, my dear aspirants, we have got 4 options, and you have to tell me exactly the correct answer, the nerve supply of circumvaled papilla, one of the papilla of the tongue, which is containing the taste buds, and this is a large size lying just, I will tell you about the location also, it is located just anterior to sulcus terminalis. So, your time starts now. Mark the correct answer, nerve supply. Question number 8. My dear aspirant, the nerve supply of circumvalent papilla is by glossopharyngeal nerve. So, glossopharyngeal nerve is the correct answer. And for the proper explanation of this MCQ, I would like to show you this diagram where you can clearly see the innervation of the tongue. So, here you can see all the muscles. So, the first important point is all the muscles of the tongue is getting innervation from 12th cranial nerve, that is 12th cranial nerve, that is hypoglossal nerve, except palatoglossus muscle, Why not palatoglossus muscle? Because palatoglossus muscle is getting innervation from the 10th cranial nerve. Along with it, it carries the cranial part of accessory nerve. Now, if I talk about sensory innervation, the area which is lying anterior to sulcus terminalis, this V-shaped sulcus is sulcus terminalis, which is dividing the whole of the tongue into anterior and posterior part. So, anterior part of the tongue is getting general sensation from lingual nerve and special taste sensation from coda-tympanic nerve. Actually, the anterior part of the tongue is derived from in relation to the first arch, and the first arch nerve is the mandibular nerve. Lingual nerve is a branch from mandibular nerve. But if I consider coda-tympanic nerve, it is pre-traumatic branch of the first arch only, and the taste sensation provided to the anterior part of the tongue is by coda-tympanic nerve. So, that clearly means we have got two innervations on anterior part of the tongue, lingual nerve for the general sensation, as you can see, and coda-tympanic nerve for special sensation. Now, if I talk about posterior part of the tongue, the posterior part of the tongue is getting innervation, both general and the sensory innervation, by the 9th cranial nerve. But if I talk about the area, which is lying just anterior to sulcus terminalis, which is containing this circumvalent papilla, you can see here, this is also showing yellow color innervation. So, this circumvalent papilla is also residing in the anterior part of the tongue, but it get innervation from glossopharyngeal nerve. So, this is very important, and you should note down that glossopharyngeal nerve is the nerve supply for that of the circumvalent papilla also. When I go to most posterior part of the tongue along with that of epiglottis, what is this? This is epiglottis. Okay. So, along with the part of epiglottis and that of posterior most part of the tongue, its innervation is by internal laryngeal nerve. Got it, everyone? Its innervation is by internal laryngeal nerve. So, let's talk about question number 9. Hazel back triangle. What is the false or the untrue statement about Hazel back triangle? Question number 9. What is the incorrect statement about the Hazel back triangle? Indirect inguinal hernia occurs through this space. It is laterally bounded by inferior epigastric artery. It is also known as inguinal triangle, and inferior boundary is by inguinal ligament. So, you have to tell me the incorrect statement about Hazel back triangle, which is also called as inguinal triangle. 4 options are there, and mark the correct answer. Question number 9. Question number 9. So, yes, you can mark the correct answer. So, my dear aspirants, A is the incorrect statement. Actually, Hazel back triangle is also called as inguinal triangle, that is absolutely right, and its inferior border is by inguinal ligament, that is also absolutely right. Laterally it is bounded by inferior epigastric artery, that is also absolutely right. So, the hernia which is traversing through the space is indirect inguinal hernia is wrong. Actually, the hernia which is traversing through the space is the direct inguinal hernia. Indirect inguinal hernia passes lateral to inferior epigastric artery and enters the inguinal canal at deep inguinal ring. So, please write down this information. This is important for you to note down. Indirect inguinal hernia is passing or traversing lateral to inferior epigastric artery lateral to inferior epigastric artery through inguinal canal. It is traversing through inguinal canal through deep inguinal ring, through deep inguinal ring, through deep inguinal ring. Got it, everyone? Through deep inguinal ring. When I am talking about direct inguinal hernia, so direct, when I talk about the direct inguinal hernia, it is traversing medial to, it will pass medial to inferior epigastric vessel, and it will pass through the Hazel back triangle. So, direct inguinal hernia passes through Hazel back triangle. Direct inguinal hernia passes through Hazel back triangle. This is very important information. Please note down. Now, me show you a diagram for it. So, here in this diagram very clearly you can appreciate this green color triangular space. This triangular space is the inguinal triangle or Hazel back triangle. This is inguinal triangle, which is also called as Hazel back triangle. And its boundary is, this is rectus abdominis muscle. So, it is bounded, as you can see here, medially by rectus abdominis muscle. It is bounded laterally by, as you can clearly see, this is inferior epigastric vessel. And it is bounded inferiorly by, it is bounded inferiorly. So, let me use a dark color green for it. What is this? So, this structure is inguinal ligament. This structure is inguinal ligament, which is extending from the anterior superior iliac spine to pubic tubercle lower part. So, inferiorly it is bounded by inguinal ligament. So, my dear aspirants, one more mnemonic I want to tell. I want to give you a mnemonic of boundaries of inguinal triangle. So, that mnemonic is RIP, R-E-P. Boundaries of inguinal triangle can be memorized by the mnemonic, that is RIP. Actually, what is the other name of inguinal ligament? Inguinal ligament is also called as paw parts ligament. So, see here, what is the other? So, if I talk about inguinal triangle boundaries, you can remember by the mnemonic RIP. We know that inguinal ligament is also called as paw parts or groin ligament. So, paw parts ligament. So, here R stands for rectus abdominis muscle, I stands for inferior epigastric vessel, and P stands for paw parts ligament. So, this is how you can memorize the triangular boundary, inguinal triangle or Hazel back triangle boundaries. So, RIP is the mnemonic which can be memorized. So, let's move on to the next MCQ. All the best for the next MCQ. Your time begins now. Question number 10th. Parotid duct pierces which muscle? So, which of the following muscle in the option provided, whether it is buccinator muscle, whether it is lateral pterygoid muscle, whether it is medial pterygoid muscle or rhizorius muscle? Question number 10. So, parotid duct is piercing which of the following muscle? Buccinator, rhizorius, medial or lateral pterygoid? Question number 10th, mark the correct answer. So, yes, your time begins now. Parotid duct piercing which muscle? The correct answer is buccinator muscle, buccinator muscle. Okay. So, yes, let me show you a diagram for it. Actually, let me show you the buccinator muscle here. This what I am highlighting here with green color, this muscle is the buccinator muscle. Okay, this muscle is the buccinator muscle, as you can see here. This is the buccinator muscle. Okay, this is the buccinator muscle. Now, structures pierced, the buccinator muscle is pierced by, so if you will see the structures piercing buccinator muscle, the structures piercing the buccinator muscle is buccal pad of fat, buccopharyngeal fascia, buccinator muscle and the duct, okay, mucous membrane. So, the structures pierced by parotid duct as it proceed from Superficial to deeper aspect is the buccal pad of fat is the first structure, buccopharyngeal membrane of fascia is the second, buccinator muscle and the mucous membrane of the oral cavity. So it opens at the parotid papilla, that is upper second molar tooth. So clearly we can see the buccinator muscle is the correct answer. Other name of parotid duct is Stinson's duct. So got it everyone? Can we move on to the next MCQ, that is MCQ number 11th? All the best. So let's move on to the next one, question number 11th. Canal through which 8th cranial nerve is passing. Canal through which 8th cranial nerve is passing. Whether it is internal acoustic meatus, whether it is foramen rotundum, whether it is foramen rotundum, whether it is So whether it is foramen rotundum, whether it is foramen lacerum, whether it is jugular foramen. So according to you, which is the correct answer? Yeah. So mark the correct answer. Your time begins now. "15 seconds will be given to you. So your time begins. Yes, A is absolutely correct answer. Actually, internal acoustic meatus, say 7th cranial nerve traverses, 8th cranial nerve traverses and labyrinthine vessel. Labyrinthine vessels traverses. So A is the correct answer. Foramen rotundum, maxillary nerve traverses, foramen lacerum. Actually, exactly the structure is not through and through traversing, but nerve of pterygoid canal is formed. Nerve of pterygoid canal is formed at the anterior aspect, that is joining of greater petrosal nerve and that of deep petrosal nerve. For deep petrosal nerve and jugular foramen, say 9th, 10th and 11th cranial nerve passes. 9th, 10th and 11th cranial nerve is traversing. So internal acoustic meatus is the correct answer. Yes, here we have got internal acoustic meatus as the correct answer, A. So I would like to show you a diagram for it. Yeah. So see here, when I am showing you this diagram, I am highlighting here, this is the internal acoustic meatus, and inside this you can see the nerve traversing is vestibulocochlear nerve, that is the 8th cranial nerve. So see here, this nerve which you are seeing here is the vestibulocochlear nerve along with its cochlear and vestibular component along with labyrinthine artery. And other than that, both the component of facial nerve, that is the motor and the sensory. So this, see here, this is the facial nerve which is traversing. So this is the facial nerve, this is the 8th cranial nerve, this is the 7th cranial nerve, facial nerve, and this is the labyrinthine artery. So labyrinthine artery is traversing, the 8th cranial nerve is traversing and the 7th cranial nerve is traversing. So 7th cranial nerve, 8th cranial nerve and labyrinthine vessel. All these structures are traversing through internal acoustic meatus. Let's move on to the next, that is question number 12. Medial border of anatomical snuff box. Which of the following is medial border of anatomical snuff box? Whether it is extensor pollicis longus, whether it is abductor pollicis longus, whether it is adductor pollicis, whether it is extensor pollicis brevis. Question number 12. Medial border of anatomical snuff box is. 4 options are there and you have to give me the correct answer for this. Your time starts now. You will be provided with 15 seconds to mark the correct answer. 15 seconds for marking the correct answer. Medial border, to be more specific, posteromedial border of anatomical snuff box is formed by which of the following muscle provided in the option? Extensor pollicis longus, abductor pollicis, adductor pollicis, extensor pollicis brevis. Your time begins now. Mark the correct answer. My dear aspirant, the correct answer is A. Extensor pollicis longus is forming posteromedial border of anatomical snuff box. Abductor pollicis longus and extensor pollicis brevis, these two muscles are forming anterolateral border. These two muscles are forming anterolateral border of anatomical snuff box, which is more prominent once you extend your thumb. So let me show you here. Very clearly you can see extensor pollicis longus muscle is forming the posteromedial border. The extensor pollicis brevis and abductor pollicis longus is forming anterolateral border. The content is radial artery, which is resting over the floor, that is a scaphoid and scaphoid trapezium bone in the floor, cephalic vein and the superficial branch of radial nerve is crossing the roof. So these all information are important, so write down. Boundaries of anatomical snuff box. Posteromedially it is bounded by extensor pollicis longus muscle. Anterolaterally it is bounded by abductor pollicis longus and extensor pollicis brevis. What is the content? The content of anatomical snuff box is radial artery. The floor is formed by scaphoid bone along with trapezium, which we have seen. As you can see here, we have seen also the trapezium bone. So scaphoid along with trapezium bone. The roof is crossed by superficial branch of radial nerve and that of cephalic vein. Okay. So it is quite clear, the boundaries of anatomical snuff box is clear and the roof is clear. The floor, content, all of these points are clear for the anatomical snuff box. So clearly extensor pollicis longus is forming the medial boundary of anatomical snuff box. So this is the reason, this is the correct answer. Okay, so my dear aspirants, let's move on to the next. Actually, scaphoid bone is commonly injured or fracture. If there is tenderness in anatomical snuff box, that means fracture of an scaphoid bone, and the major abnormalities which is seen is the avascular necrosis, because peculiar blood supply is there of scaphoid bone from the distal aspect. So radial artery crossing the floor and is the content also. So let's move on to the next, that is question number 13. Vein of Galen drains into which one of the following? Whether it drains into straight sinus, whether it drains into sigmoid sinus, whether it drains into internal jugular vein or superior longitudinal sinus. Question number 13. Vein of Galen drains into which one of the following? 4 options are there. Straight, sigmoid sinus, internal jugular vein, superior longitudinal sinus. So yes, 13 seconds will be provided to you and you have to mark the correct answer. Yes. So my dear aspirants, the correct answer here is straight sinus. Vein of Galen drains into straight sinus. A is absolutely correct answer. Let me show you a diagram for it. So yes, here you can see the internal cerebral veins has been shown joined by basilar vein. Actually internal cerebral veins and 2 of the side is joining and leading to the formation of great cerebral vein of Galen. Now further, if you trace the great cerebral vein of Galen, what you can appreciate here, the great cerebral vein of Galen is drained into this sinus which is clearly seen, and that is straight sinus. So great cerebral vein of Galen is draining into straight sinus, will continued with the confluences of the sinus, which is also called as confluences of the sinus or trocula, where the sinus is joining. As you can see, straight sinus is drained here. Okay, so clearly the correct answer, which is quite clear by seeing this diagram, is that the great cerebral vein of Galen is draining into straight sinus. So we have got straight sinus as the correct answer for question number 13. Let's move on to the next question number 14. Proprioceptive sensation is carried by which of the following fibers? So we have got 4 options and you have to tell me the correct answer. Proprioceptive sensation is carried by which one of the following? Whether it is fasciculus cuneatus or fasciculus gracilis, whether it is anterior spinothalamic tract, lateral spinothalamic tract or spinocerebellar tract. Question number 14. You will get 15 seconds to mark the correct answer. Question number 14. My dear aspirants, proprioceptive sensation is basically carried by dorsal column tract, and the correct answer here will be, A. Fasciculus cuneatus and fasciculus gracilis. These are the two of the important tracts which is carrying proprioceptive sensations. When we are talking about, let me tell you about the other option which is provided, anterior spinothalamic tract and lateral spinothalamic tract. This is very important for you to know which is that sensation which is transmitted via anterior spinothalamic tract. So the anterior spinothalamic tract is transmitting sensations like coarse touch and pressure basically. If I talk about lateral spinothalamic tract, it is mainly transmitting which sensation? Pain and that of temperature sensation. Pain and that of temperature sensation. Now there is spinocerebral tract, ventral and dorsal spinocerebral tract is, and basically the sensation transmitted is unconscious proprioceptive sensation. Unconscious proprioceptive sensations. Unconscious proprioceptive sensation is transmitted by the spinocerebral tract, that is D option. Question number 14, D. So all the options has been, their function has been designated, and clearly with this explanation we can clearly tell that the correct answer which is transmitting proprioceptive sensations is by fasciculus cuneatus and fasciculus gracilis. Okay, my dear aspirants, let's move on to question number 15. Parasympathetic supply to parotid gland is traversing through which of the following ganglion? Whether it is otic ganglion, whether it is submandibular ganglion, and whether it is pterygoid ganglion, or whether it is ciliary ganglion. So we have got 4 options and you have to choose the correct answer. Question number 15. Parasympathetic supply to parotid gland is traversing through which one of the following ganglion? Otic ganglion, submandibular ganglion, and pterygoid ganglion and ciliary ganglion. Got it? Question number 15. "15 seconds will be provided to you for marking the correct answer. The correct answer here is, otic ganglion. Otic ganglion is the correct answer. Parasympathetic supply to parotid gland is through otic ganglion is the correct answer. So my dear aspirants, let me show you a diagram where the sympathetic sensory and parasympathetic innervation of parotid gland is shown. See here. So here 3 parasympathetic fibers which is shown by the green color. As you can see, parasympathetic fibers has been designated by green color. And if you will see the preganglionic parasympathetic fibers, so preganglionic parasympathetic fibers are originating from inferior salivary nucleus, which is located on the lowermost part of the pons, and from here the glossopharyngeal nerve, via glossopharyngeal nerve it is traversing, and its tympanic branch is forming a plexus which is called as tympanic plexus, which again traverses via lesser petrosal nerve, and these fibers will relay in the ganglion. Which ganglion it is relaying? Can you see here? This is the ganglion where it is relaying, and this ganglion where it relays is called as otic ganglion. So it will relay in otic ganglion, and from here postganglionic parasympathetic fibers traverses via auriculotemporal nerve and will supply the parotid gland. So which fibers it the parasympathetic innervation से कौन सा फाइबर ट्रांसमिट होता है? सेक्रेटोमोटर फाइबर्स विच इज रिक्वायर्ड फॉर द salivary secretion, watery saliva secretion of the parotid gland is passing via otic ganglion, and the innervation is parasympathetic innervation. When I am talking about sympathetic innervation arises from the superior cervical sympathetic ganglion में ये fibers relay होते हैं, then it will cover along the arteries. As you can see here, it will form middle meningeal artery, it will form it will cover around and it will provide sympathetic innervations. When I am talking about the sensory fibers will pass via auriculotemporal. Ultimately, all the innervation will traverse along the auriculotemporal nerve and will supply parotid gland. If I am talking about only the parasympathetic flow chart or the parasympathetic innervation, so it's quite clear that it is traversing via otic ganglion. The fibers are relaying in the otic ganglion. The sequential flow chart will be preganglionic fibers arising from inferior salivary nucleus, passes via glossopharyngeal nerve, tympanic branches forming tympanic plexus, traverses via lesser petrosal nerve and ultimately relay in otic ganglion. From here via postganglionic fibers traversing along auriculotemporal nerve and will supply the parotid gland. So basically otic ganglion is the correct answer. Now clavipectoral fascia is pierced by which one of the following structure? Whether it is pierced by axillary vein, whether it is pierced by axillary artery, whether it is pierced by brachial artery or that of cephalic vein. So 4 options are there and you have to mark the correct answer. Clavipectoral fascia is pierced by which one of the following? 4 options are there. You will get 15 seconds to mark the correct answer. So yes, the correct answer here is cephalic vein. D option is the correct. Actually, clavipectoral fascia, what is the location of clavipectoral fascia? Clavipectoral fascia is located deep to pectoralis major muscle fascia, and it starts superiorly below the clavicle. There it will enclose a small muscle that is called a subclavius muscle residing in the subclavian groove. Lower down it will come vertically when it is traced. It will enclose another small muscle that is pectoralis minor muscle, and lower down it will merge with axillary fascia. So this is the fascia. Exact location is below the pectoralis major fascia, and 4 structures are traversing or piercing. 4 structures are piercing it. That 4 structures are, so let me write the details of 4 structures. The 4 structures are cephalic vein, lateral pectoral nerve, thoracoacromial artery, and lymphatics passing through up the axillary region, lymphatics. So my dear aspirant, here cephalic vein, tributaries of the axillary vein, lateral pectoral nerve, branch of lateral cord of brachial plexus, thoracoacromial artery, branch of second part of axillary artery, and lymphatics, and that of the lymphatics. So lymphatics which is traversing towards the apical aspect of the axillary region. These are the 4 structures which is piercing clavipectoral fascia. What is the location of clavipectoral fascia? It is located deep to pectoralis major muscle fascia. So see here what I told you, the clavipectoral fascia, let me again use a green color deeper aspect. Lower to the clavicle it will enclose which small muscle? Subclavius muscle residing in the subclavian groove. Lower down it descend down and enclose another small muscle which is lying deep to pectoralis major fascia, that is pectoralis minor muscle, and lower down it merges with this axillary fascia. So this is a diagram which is showing vertical tracing of the clavipectoral fascia. So this diagram is showing vertical tracing of clavipectoral fascia, and the structure which is piercing it, the structures which is piercing it is cephalic vein, the lateral pectoral nerve, thoracoacromial artery, and the lymphatics, and also the lymphatics. Fourth structure is the lymphatics. So all these structures has been shown here: cephalic vein, lateral pectoral nerve, thoracoacromial arteries. All these structures are piercing it. And this is the pectoralis major muscle. Deep to it lies the clavipectoral fascia. Deep to it lies the clavipectoral fascia. Done with it, let's move on to the next MCQ. Okay, so that is the MCQ number 17. Okay, so all the best for question number 17. Supraventricular crest lies between which one of the following? Pulmonary orifice, arterioventricular orifice, and the fossa ovalis, superior vena cava opening, and the right atrium, the right and the left coronary artery. My dear aspirants, we have got 4 options here and you have to choose the best possible answer. Supraventricular crest lies between which one of the following? 4 options are there. I will provide you with 15 seconds and you can mark the correct answer. Supraventricular crest. Actually, the correct answer is option A. It is located between pulmonary orifice and that of arterioventricular orifice. Okay. So this is the definition for the supraventricular crest. This is the location. I would like to define it. So when I am talking about supraventricular crest, what is it exactly? How we can define the supraventricular crest? Supraventricular crest is a muscular ridge and it is located in the right ventricle and it is separating actually the outflow tract of the conus arteriosum, that is also called as infundibulum. So it is separating the infundibulum part, that is the outflow tract, from the rest of the ventricular cavity. That means it is separating the rough and the smooth part of the right ventricle. What is it? It's a muscular ridge. What is it? It's just a muscular ridge located in the right ventricle. So clear, my dear aspirants. Now the next point is, if we see the location, it is exactly passing obliquely from the interventricular septum. Where it is passing? It is passing from the interventricular septum to the anterior wall of right ventricle. It is passing between the interventricular septum to the anterior wall of the right ventricle. Now see here, this is exactly the supraventricular crest, as you can see here, which is forming a separation between the smooth part and the rough part. So see here, this is the rough part which is showing the muscular ridges and the papillary muscles. So it is showing all the papillary muscles here. We have got 3 papillary muscles in the rough part of the right ventricle, that is the anterior, posterior, and the septal papillary muscle. It is separated from the smooth part. You can see here supraventricular crest in other form. How you can define it, it is exactly located as between the smooth part and that of the rough part, and its location, if we talk about its opening, which is forming a communication or exact connecting part, it is lying exactly between arterioventricular orifice and that of pulmonary orifice. So pulmonary orifice, we know that it is located in the interior of right ventricle, from which pulmonary trunk arises, arterioventricular orifice. So this is the extent of supraventricular crest. For question number 17, A is perfectly the correct answer. Also the definition is correct. It is a muscular ridge dividing the infundibulum smooth part of the right ventricle from the rest rough part of the right ventricle. Okay, my dear aspirants, let's move on to the next, that is question number 18. Testis drains into which one of the following lymph node? Testis drains into which one of the following lymph node? Whether it is para-aortic group of lymph node, whether it is inguinal group of lymph node, whether it is iliac lymph node, whether it is pre-aortic group of lymph node. So your time starts now. We have got 4 options and you have to choose the correct answer. 4 options are there: para-aortic lymph node, inguinal lymph node, iliac lymph node, pre-aortic group of lymph node. Fifteen seconds is given to you to mark the correct answer. So it's a direct question, Actually, my dear aspirant, the correct answer is para-aortic group of lymph node. Testis is drained by para-aortic group of lymph node. So yes. Inguinal is again divided into superficial and deep inguinal. Superficial inguinal drains the scrotum. The para-aortic group of lymph node is draining the testis. So A is perfectly the correct answer for this MCQ. From the superficial and inguinal lymph node, the lymphatics is drained into deep and then it will go to external iliac lymph node. Pre-aortic group of lymph node is lying in close relation to abdominal aorta, and here the correct answer for the drainage of testis is para-aortic group of lymph node. Let's talk about the triangle of auscultation. Which of the following is the true statement for the boundaries of triangle of auscultation? 4 options are there. Lateral boundary is by latissimus dorsi muscle, medial boundary is by scapula, inferior boundary is by latissimus dorsi muscle, lateral boundary is by trapezius muscle. So you will get 15 seconds and you have to give me the correct answer. Which of the following statement is absolutely the true statement regarding the boundaries of triangle of auscultation? Question number 19. Mark the correct answer. My dear aspirants, the correct answer is C. Boundary of triangle of auscultation. Inferiorly it is bounded by latissimus dorsi muscle. What is the boundary? Inferior boundary is by latissimus dorsi muscle. So it is bounded inferiorly by latissimus dorsi muscle. So this is absolutely correct answer. C is the correct answer. Okay. Now let me show you this diagram where you can clearly emphasize the boundaries of triangle of auscultation. So yes, if I use this black color triangular space, okay, so this space is the triangle of auscultation and its boundary will be, so it is bounded medially by trapezius muscle, it is bounded laterally by medial border of scapula, inferiorly by latissimus dorsi. So this is the latissimus dorsi which is forming the inferior boundary. So only we have I have told that inferior boundary latissimus dorsi LD is the absolutely correct answer. Trapezius muscle and also medial border of scapula. Actually medial border of scapula will be overlapped by rhomboides major and minor muscle, and these two medial border is also forming its lateral boundary, and medially it is bounded by trapezius muscle. Triangle, why it is called as triangle of auscultation? So by seeing this diagram, it is quite clear to you that it is not overlapped by any kind of muscle. It is not directly overlapped by any kind of muscle. So this is an area where we have got the relation. So which structure lies in the floor? The floor. Triangle of auscultation, the floor structure is 6th rib and the 7th rib. So it is related with 6th rib, 7th rib, and it is related with the lower lobes of the lung or both the side. So when a physician or a doctor want to hear the breath sound, they can hear the breath sound directly on this region, triangle of auscultation, because it is closely related, not overlapped by any muscles, and it is related to the lower lobe of the both right and the left lung. So clearly the resonant sound or breath sound can be heard. If it is dull, that means it is there is accumulation of any kind of fluid in that area. So inferior boundary is by latissimus dorsi muscle. So C is absolutely correct answer. Okay, my dear aspirants, let's move on to the next, that is question number 20th. Damage to which of the following nerve will lead to loss of adjacent side of great and the second toe, and also impaired dorsiflexion of the foot. So here motor involvement has been shown, that is dorsiflexion of the foot is involved. The sensory loss which is designated is adjacent side of great and the second toe. So these are the information and the key points which is provided: sensory loss, adjacent side of the great and that of the second toe, and dorsiflexion of the foot, that is the motor loss. So by seeing this, you have to mark the correct answer for question number 20th, whether it is A, superficial peroneal, whether it is B, lateral plantar, whether it is C, deep peroneal, or the sural nerve. 15 seconds will be provided to you for marking the correct answer. The correct answer is deep peroneal nerve. Deep peroneal nerve. My dear aspirants, deep peroneal nerve is the nerve of, it is supplying muscles of anterior compartment or anterior aspect of the leg, which is containing extensor hallucis longus muscle, extensor digitorum longus, tibialis anterior, peroneus tertius muscle. All these muscles are causing dorsiflexion of the foot. So in this diagram, in this MCQ, dorsiflexion of the foot was impaired. That was the hint provided. The other hint and the other key point which was provided in this MCQ was sensory loss in the adjacent first and second toe. So actually, when you will see the dorsum aspect of the foot, you can see the area along in between the first and second great toe is the area of innervation, sensory innervation by deep peroneal nerve. I would like to show you that diagram and it will be clear to you. So let me show you that diagram. So yes, very nicely you can see, we know that common peroneal nerve is the component of sciatic nerve. This common peroneal nerve still divides into superficial peroneal nerve and that of deep peroneal nerve. Superficial peroneal nerve will go to the lateral compartment of the leg and deep peroneal nerve will go to the anterior compartment of the leg. And clearly you can see the area adjacent to that of great and second toe is the area of sensory distribution of this is the area of sensory distribution of deep peroneal nerve. So this is absolutely correct answer. Saphenous nerve is giving innervation to medial aspect, superficial peroneal nerve, lateral and sural nerve to the lateral aspect of the foot, as you can see. So clearly deep peroneal nerve is involved and the correct answer will be C, deep peroneal nerve. Absolutely right. So let's move on to the next. So my dear aspirants, before ending the session, what I want you to tell, that it's important thing before ending the session, that if you are going to take 2 years of subscription, you are getting 4 months of subscription absolutely free. And if you are going to take 1 year of subscription, you get 2 months of subscription absolutely free. If you are going to take 6 months of subscription, you get 1 month of subscription absolutely free. So this is the this will be useful for you. So use this code ANAT10 and avail the opportunity of 10% discount if you want to take the subscription of Unacademy or you are wanting the subscription of Iconic. So both the subscription Iconic and that of Plus subscription can be taken. By using the code ANAT10, you will get additional discount of 10%. So this is an opportunity will be soon going to end, this discounted rate and the free monthly subscription along with your subscription. So just grab this opportunity if you are thinking of taking the subscription, whether this is applicable, and you can just take the subscription and you can grab this opportunity. Okay, my dear aspirants, I would also like to tell you about the important announcement on 28th of November, 5 p.m. is the timing. is the NEET PG Combat. So go grab, do present. It is a free session, free test. This is a biggest scholarship test for the NEET PG examination. So a scholarship of worth of 1 crore rupees is there. So just go and enroll by using the code NAT10. You can enroll it and be present for this session and grab. So till 200 rankers will get absolutely exciting prizes, Amazon vouchers of up to 20,000 rupees, scholarship worth of 1 crore rupees. So just go and grab this opportunity. My dear aspirant, I also want to tell that today 6 p.m. Today 6 p.m. What I am going to do at the 6 p.m. session. 6 p.m. time is dedicated to special class, special free session. So I am going to take a special free session on the Unacademy platform. So for this you have to download the Unacademy app. You will be present for this session and you can join me for the session. What is the topic which I am taking? So the topic which I am taking is the parasympathetic ganglion of head and neck region. So the topic which I am taking is parasympathetic ganglion of head and neck region. So I am completing this topic, parasympathetic ganglion of head and neck region. Timing is 6 p.m. today itself. So today is Saturday. Today itself I am taking. Sunday morning I will again start with the MCQ session 10 and 11 a.m. So you can join me for the Sunday session also. So the 6 p.m. session will be highly beneficial. So you can join me that for the special free session and do present. This will be beneficial for you. And before ending the session, what I want you to tell that thank you everyone for joining this session. I think this will be highly beneficial for you. I will in the upcoming session I will come up with more sessions. Thank you. Subscribe, do like and subscribe the NEET PG Unacademy platform. Let's crack NEET PG Unacademy platform. PDF notes can be downloaded. If you are going to attend the special free session, download the PDF notes. Thank you so much. We will again meet today evening 6 p.m. for the special free session on the Unacademy app. Sunday 10 a.m., 11 a.m., 12 a.m. So these are 12 p.m. These are the morning sessions. 2 or 3 sessions of special free sessions will be there. So you can join me there also. All the best. Keep studying. All the best. Thank you so much, dear students. Thank you.